Cardiovascular System Overview. The cardiovascular system fulfills the needs of tissues. It transports nutrients to the tissue and removes metabolic waste product. It also transports hormones. The CVS or cardiovascular system consists of three parts: the heart, blood vessels, and blood. Arterial end of capillaries brings oxygen, water, glucose, and amino acid to the tissue. But venous end of capillaries takes water, waste product, and carbon dioxide from tissue and transport that to the kidneys and lungs for filtration. The heart is actually two separate pumps. Right heart that pumps blood through the lungs. Left heart that pumps blood through the systemic circulation. Deoxygenated blood or carbon dioxide-rich blood travels from the body to the right side of the heart and from the right side of the heart to the lungs to receive oxygen and release carbon dioxide. This oxygenated or oxygen-rich blood returns to the left side of the heart and is then distributed throughout the body again to meet the needs of the body's organ. Now we will briefly discuss the anatomy of the heart, which helps in understanding its physiology. The heart has two atria, right atrium and left atrium, and has two ventricles, right ventricle and left ventricle. The tricuspid valve, which is located between right atrium and right ventricle. The mitral valve, which is located between left atrium and left ventricle. The pulmonary valve, which is located at the origin of the pulmonary trunk. The aortic valve, which is located at the origin of the aorta. The septum, a muscular wall that divides the heart's ventricles, is called interventricular septum, and a thin wall of tissue that separates atria is called interarterial septum. The superior vena cava, which brings blood from the upper part of the body to the right atrium. And also we have inferior vena cava, which brings blood from the lower part of the body to the right atrium. The pulmonary artery, which originates from the right ventricle and carries blood from the right ventricle to the lungs to receive oxygen. The pulmonary veins, which brings blood to the left atrium from the lungs. The aorta, which originates from the left ventricle, delivers oxygenated blood to the entire body. The heart wall has three layers: epicardium, myocardium, and endocardium. Epicardium is outer protective layer, myocardium is muscular middle layer, and endocardium is thin inner layer. The epicardium has two main parts: parietal pericardium, which is outer layer, and visceral pericardium, which is directly attached to the heart. Between these two layers, we have pericardial cavity, which has pericardial fluid. The heart is composed of three major types of cardiac muscle: arterial muscle, ventricular muscle, and specialized excitatory and conductive muscle. So this was a brief and concise overview of the CVS or cardiovascular system. Thank you for staying until the end. I will see you in the next video.